Welcome to another deep dive. We've got a big one today.
We do.
Helping you understand common chronic neurological problems. You guys sent in a ton of material.
And so we've mixed
narrowed
it
it down
Yeah.
to the most important stuff, the things you need to know,
Absolutely.
what to look for, how nurses approach these situations,
All right.
and what you can expect in terms of treatment.
Yeah.
We're going to be covering headaches, epilepsy and seizure disorders, restless leg syndrome, multiple sclerosis, Parkinson's, myasthenia gravis,
Right.
ALS, and even Huntington's disease.
It's a lot, but it's fascinating stuff, and it's really important for people to understand.
Yeah.
So let's dive in.
Let's kick things off with headaches.
Okay.
Like we've all experienced those at some point.
Probably.
The research you sent over mentions three main types: tension headaches, migraines, and cluster headaches.
Right.
What are the key signs that distinguish one from another?
Well, tension headaches are the most common type, and they usually feel like a tight band or pressure around your head. Usually it's on both sides.
Okay.
And migraines, those are different. It's a throbbing pain. Often it's on one side.
Yeah.
And these can last for hours or even days. And some people even experience visual disturbances,
Really?
nausea or sensitivity to light and sound with a migraine. Cluster headaches, those are less common, but they're way more intense.
Oh, no.
It's a sharp stabbing pain, usually around one eye.
Okay.
And these tend to occur in clusters over a period of days or weeks,
Makes sense.
hence the name.
It sounds like if you're experiencing headaches, it's crucial to pay attention to those specific characteristics
It is.
to figure out what type you're dealing with.
Exactly.
What are some things nurses look for when assessing someone with a headache?
Well, they're really good at asking all the right questions.
Okay.
So they'll ask about the location, intensity, and type of pain, of course.
Okay.
But they'll also try to pinpoint any triggers. Did it come on after eating certain foods? Are you stressed?
Yeah.
Did you miss your usual caffeine fix? Things like that. And those details can offer clues about the type of headache and guide treatment decisions.
So it's like detective work.
It really is.
Beyond gathering clues, what are some nursing actions that might help someone experiencing a headache?
Well, nurses have a lot of tools in their toolkit for headache relief.
Okay.
They can administer medications as ordered by the doctor, ranging from over-the-counter pain relievers to prescription migraine meds like triptans.
Oh. Okay.
Now, triptans, they work by targeting blood vessels in the brain, which is different from how typical pain meds work.
Well, that's interesting. So it's not just about masking the pain.
Right.
It's addressing the underlying mechanisms.
Absolutely. And nurses are also big on non-drug approaches.
Okay.
They can teach relaxation techniques like deep breathing exercises.
Okay.
Those can be surprisingly effective for tension headaches. They might even suggest biofeedback,
Okay.
which is where you learn to control your body's responses to stress.
Interesting. So it's a combination of targeted medication and empowering patients
Yeah,
to manage their headaches.
absolutely.
What about long-term treatments? What can people do to prevent headaches from happening in the first place?
Oh, that depends on the type of headache. For tension headaches, identifying and managing stress is key.
Okay.
Yoga, meditation, even a hot bath can help.
Oh, nice.
For migraines, keeping a headache diary to track triggers is essential.
A headache diary?
Yeah.
Okay.
So once you know what sets them off, whether it's certain foods, lack of sleep, or hormonal changes,
Right.
you can start avoiding those triggers.
It seems like being proactive and paying attention to your body is
Yeah.
crucial for managing headaches effectively.
Absolutely. And remember, if headaches are frequent or severe, it's always best to consult with a healthcare professional
Okay.
to rule out any underlying medical conditions.
Excellent advice. All right, let's shift gears and talk about something a bit more complex. Epilepsy and seizure disorders.
Okay.
The materials you gave me highlight that epilepsy is a condition that causes seizures,
Yes,
which are basically these sudden bursts of electrical activity in the brain.
exactly.
I found it fascinating that seizures can manifest in so many different ways. Could you elaborate on that?
Absolutely. So think of the brain like a vast electrical grid. A seizure happens when there's a surge of electrical activity in one area of the grid,
Okay.
and the effects depend on where that surge occurs.
Interesting.
So sometimes the entire grid goes haywire. That's what we call a generalized seizure. You might see the classic convulsions, loss of consciousness, the whole works.
Yeah.
But sometimes it's localized. just affecting a small part of the brain.
Okay.
Those seizures can be much more subtle,
Okay.
maybe just a twitch, a strange sensation, or a brief lapse in awareness.
Wow, that's incredibly insightful. I had no idea there was such a wide spectrum of seizure presentations.
Yeah.
So if someone's having a seizure, what's the most important thing a nurse needs to do?
Well, the most important thing is safety.
Okay.
First and foremost, you want to protect the person from injury.
Right.
So if they're falling, try to guide them gently to the floor and clear the area around them. Never restrain them or try to put anything in their mouth.
Got it.
Nurses are trained to assess the situation quickly, make sure the person's airway is open, and provide oxygen if needed.
Okay.
They also carefully document what happened, how long the seizure lasted, what the person was doing before and after, any other symptoms they observed.
Wow.
All this information is crucial for the doctor to fine-tune the treatment plan.
It sounds like nurses play a vital role in both the immediate response and the long-term management of epilepsy. What about preventing seizures in the first place? What kind of treatments are available?
Well, the cornerstone of epilepsy treatment is medication. We call them anti-seizure medications or anti-epileptic drugs.
Okay.
These medications work by calming down the hyperexcitable brain cells that are prone to causing seizures.
Okay.
The trick is finding the right medication at the right dose for each individual.
So it's not a one-size-fits-all approach.
Not at all. It often takes some trial and error to find the optimal medication regimen.
Okay.
Nurses are instrumental in educating patients about their medications, monitoring for side effects, and advocating for adjustments if needed.
That level of personalized care seems so important, especially with a condition as complex as epilepsy. Okay, let's move on to something that sounds a bit more mysterious, even a little quirky. Restless leg syndrome, or RLS.
All right.
It definitely has a unique set of symptoms.
It does.
Imagine trying to relax in the evening.
Yeah.
Maybe settle in with a good book, but you have this overwhelming urge to move your legs.
Yeah.
It's not exactly pain, but more like a deep creeping discomfort that just won't quit.
Right.
And it gets worse when you're trying to rest, especially at night. That's the hallmark of restless leg syndrome.
That's it.
I can see how that would be incredibly frustrating,
It is.
especially when you're trying to get a good night's sleep. What causes this strange sensation, and what can people do to find relief?
Well, RLS is still somewhat of a puzzle,
Okay.
but we do know that it's related to how the brain uses dopamine,
Okay.
which is a neurotransmitter involved in movement.
Right.
So it's like there's a miscommunication happening in the dopamine pathways,
Okay.
leading to that irresistible urge to move.
So for some people, it's tied to iron deficiency,
Right.
pregnancy, or certain medications.
Mm-hmm.
But for many, the cause remains unknown.
Yeah,
So it sounds like a bit of a mixed bag
it is.
in terms of causes.
It is.
What about treatment?
Okay.
What are some things that nurses can do to help people with RLS?
Well, nurses are excellent at providing supportive care and guidance for people with RLS.
Okay.
They can help patients identify potential triggers like caffeine, alcohol, or certain medications,
Okay.
and encourage lifestyle changes like regular exercise and a consistent sleep schedule.
So it's about empowering patients to manage their condition.
It is.
Are there any medical treatments available for RLS?
Yes, absolutely. For more severe cases, medications like dopamine agonists can be very effective.
Okay.
These drugs essentially mimic the effects of dopamine in the brain, helping to reduce those uncomfortable sensations and the urge to move.
Okay.
Nurses play a key role in educating patients about these medications, monitoring for side effects, and ensuring they're taking them correctly.
It sounds like a multifaceted approach
Yeah,
is essential for managing RLS effectively.
it really is.
Well, this has been a fantastic deep dive into these complex neurological conditions. We've learned so much about headaches, epilepsy, and restless leg syndrome. I'm really starting to see how crucial nurses are in supporting patients and helping them manage these chronic conditions.
They really are on the front lines of care,
Yeah.
providing expertise, compassion, and practical guidance every step of the way.
I'm excited to continue exploring the rest of the conditions you've outlined in your materials. It's amazing how much we've learned in just a short amount of time.
Me too. There's so much more to uncover. It's incredible how much ground we've covered already. From tension headaches to the complexities of epilepsy, it's clear that the brain and nervous system are intricate and fascinating.
I agree. And we've still got several conditions to explore. You know, one that's always intrigued me is multiple sclerosis, or MS. It's a condition we hear about often, but I'm not sure I fully grasp What's happening in the body when someone has MS? Can you shed some light on that?
Absolutely. Picture the nerves in your brain and spinal cord as electrical wires, each coated in a protective layer called myelin.
Okay.
Myelin acts like insulation, allowing those electrical signals to zip around efficiently.
Interesting.
In MS, the body's immune system mistakenly attacks this myelin, causing inflammation and damage.
Oh, wow. So it's like stripping the insulation off those wires,
Exactly.
leading to all sorts of communication problems between the
Right.
brain and the body.
You got it.
The materials you provided mentioned that the symptoms can vary a lot from person to person.
They do.
Why is that?
Well, that's one of the most challenging aspects of MS. It's a bit like a neurological chameleon, manifesting differently in each individual.
Interesting.
So one person might experience primarily muscle weakness,
Okay.
while another might have vision problems
Oh, wow.
or difficulty with balance and coordination.
Okay.
Fatigue is also a very common and debilitating symptom, often described as an overwhelming exhaustion
Yeah.
that's not relieved by rest.
With such a diverse range of symptoms, diagnosing MS must be quite tricky.
It can be, yeah.
What are some of the signs nurses should be looking for?
Well, you're right. There's no single test that definitively says you have MS.
Okay.
It's a process of piecing together clues, much like a detective solving a mystery.
Right.
Nurses play a vital role in this process by carefully assessing the patient's medical history, paying attention to any neurological symptoms they report, and observing their physical abilities. They might notice subtle changes in gait, balance, or coordination, or pick up on signs of muscle weakness or sensory disturbances.
So nurses are really the eyes and ears on the ground,
Yes,
gathering those crucial pieces of information.
absolutely.
What happens once a diagnosis of MS is suspected? What are the next steps?
Well, if MS is suspected, the doctor will typically order a battery of tests, including an MRI,
Oh,
to look for those characteristic lesions in the brain and spinal cord.
right.
They might also do a lumbar puncture, sometimes called a spinal tap, to analyze the cerebrospinal fluid for specific markers of inflammation.
Okay.
Nurses often help prepare patients for these procedures, explain what to expect, and provide reassurance and support.
Okay, so let's say someone is diagnosed with MS.
Right?
What happens next? What can be done to manage this condition?
Well, while there's no cure for MS yet, the good news is that there are many treatments available to manage the disease and improve quality of life. Medications can help modify the course of the disease,
Okay.
reducing the frequency and severity of relapses,
Okay.
and manage specific symptoms
Yeah.
like fatigue, spasticity, or pain.
It sounds like a multidisciplinary approach is needed,
It is.
with various healthcare professionals working together.
Absolutely.
What's the nurse's role in all of this?
Well, nurses are absolutely essential members of the MS care team.
Okay.
They provide education about the disease and its management, teach patients how to administer their medications, and help them manage symptoms like fatigue and spasticity.
Okay.
They're also skilled in assessing a patient's mobility
Yeah.
and recommending assistive devices or adaptive strategies to maintain independence. But perhaps most importantly, nurses are there to provide emotional support, because dealing with a chronic, unpredictable disease like MS can take a toll on mental health.
It's so important to have that compassionate presence, someone who understands the challenges and can offer guidance and support. Okay, let's move on to another condition that's often in the news, Parkinson's disease. What can you tell us about this condition?
Okay, so Parkinson's disease is a progressive neurological disorder
Mhm.
that primarily affects movement.
Okay.
Imagine a conductor leading an orchestra. The conductor's job is to ensure all the musicians are playing in sync, creating beautiful music.
Okay.
In Parkinson's, the conductor's signals become faulty,
Okay.
resulting in movements that are slow, stiff, and uncoordinated.
That's a great analogy. What causes those signals to go haywire in the first place?
It all boils down to a loss of brain cells that produce dopamine, a neurotransmitter that plays a key role in smooth, coordinated movement.
Right.
As dopamine levels decline, people start to experience the classic symptoms of Parkinson's.
And what are those classic symptoms?
Okay.
I know tremors are common, but what else should we be looking for?
You're right. Tremors are a hallmark symptom, often starting in one hand as a kind of rhythmic shaking at rest.
Okay.
But there's a handy acronym to remember all four cardinal symptoms. TEAR.
Tree.
Okay. T stands for tremors.
Okay.
R for rigidity or stiffness in the limbs.
Okay.
A for akinesia, which means slowness of movement.
Gotcha.
And P for postural instability, meaning problems with balance and coordination.
Those symptoms sound incredibly challenging to live with.
Oh.
What can be done to help people with Parkinson's manage their condition?
Well, while there's no cure for Parkinson's yet, there are medications and therapies that can significantly improve symptoms and quality of life.
Okay.
Medications that either replace dopamine or mimic its effects in the brain are the mainstay of treatment. These drugs can help reduce tremors, stiffness, and slowness of movement. In addition to medication, physical therapy, occupational therapy, and speech therapy can all play a role in maintaining mobility, independence, and communication skills.
So it's about finding ways to maintain function and independence for as
Yeah.
long as possible. What role do nurses play in the care of Parkinson's patients?
Nurses are incredibly important throughout the course of the disease.
Okay.
They educate patients and families about Parkinson's, its progression, and the available treatment options. They help manage medications, assess for side effects, and provide guidance on adjusting doses as needed.
Okay,
Nurses are also skilled in helping patients with mobility and daily activities,
great.
finding creative solutions and adaptive strategies
Yeah.
to maintain independence and safety. For instance, they might recommend assistive devices like walkers or canes,
Okay.
or suggest modifications to the home environment
Yep.
to prevent falls.
It sounds like nurses wear many hats
They do.
when it comes to Parkinson's care, providing both medical expertise and practical support.
Absolutely. They're educators, advocates, and compassionate caregivers, all rolled into one.
Now let's talk about another neuromuscular condition, myasthenia gravis.
Right.
The name sounds a bit intimidating. What exactly is this condition?
Think of your muscles as receiving instructions from your nerves, like a
Ah.
coach sending signals to their team. This communication happens at a special junction, like a tiny meeting point between the nerve and the muscle.
Okay.
In myasthenia gravis, the body's own immune system mistakenly attacks these junctions, disrupting the transmission of signals from the nerves to the muscles.
So the messages get lost in translation,
Yeah,
leading to muscle weakness.
right.
What are some of the common signs of myasthenia gravis?
The muscles involved in eye movement, chewing, swallowing, speaking, and even breathing are often affected first.
Wow. Okay.
So you might see drooping eyelids, double vision, difficulty chewing or swallowing, slurred speech, and shortness of breath, especially with exertion. Nurses are trained to recognize these symptoms and initiate appropriate interventions.
What kind of interventions are we talking about? What can be done to help people with myasthenia gravis?
Well, there are several approaches to managing this condition. Medications that boost the levels of acetylcholine, the neurotransmitter involved in muscle contraction, can help improve muscle strength. Corticosteroids and other immunosuppressant drugs can help dampen the immune system's attack on those neuromuscular junctions. In some cases, a procedure called plasmapheresis, which filters the blood to remove harmful antibodies, can provide short-term relief.
So there are ways to manage the symptoms and improve quality of life. What about the role of nurses in caring for people with myasthenia gravis?
Nurses are critical members of the care team. They monitor patients closely, especially for signs of respiratory distress, which can be a serious complication.
Okay.
They administer medications, educate patients about potential side effects, and teach them how to manage their condition at home. For example, they might advise patients to schedule activities for times when their energy levels are highest, to pace themselves and to avoid overheating. Nurses also provide emotional support and encouragement, which is so important when dealing with a chronic illness like myasthenia gravis.
Okay, let's delve into a particularly challenging neurological condition. Amyotrophic lateral sclerosis, or ALS,
Right.
which is also known as Lou Gehrig's disease.
Okay.
ALS is a devastating neurodegenerative disease
It is.
that affects the nerve cells responsible for controlling voluntary muscle movement.
Yes.
Imagine your brain sending signals to your muscles telling them to move,
Right.
but those signals getting weaker and weaker over time. That's essentially what happens in ALS. The motor neurons, which are the nerve cells that transmit those signals, gradually degenerate and die.
That's right.
So as those motor neurons die off, the muscles become weaker and eventually paralyzed.
Yeah.
What are the early signs of ALS?
It can be tricky to diagnose ALS early on
Oh,
because the symptoms can be subtle and easily mistaken for other conditions.
right.
Some people might experience muscle twitches or cramps, weakness in the hands or arms, slurred speech, or difficulty swallowing. Nurses play a crucial role in recognizing these early signs and flagging them for the doctor's attention.
That sounds incredibly difficult, both physically and emotionally.
It is.
Are there any treatments that can help people with ALS?
Sadly, there is no cure for ALS,
Okay.
and current treatments focus on managing symptoms and improving quality of life for as long as possible.
Oh.
There is one medication, Riluzole, that has been shown to modestly slow the progression of the disease,
Okay.
but it doesn't reverse the damage that's already been done.
Good.
Other medications can be used to manage symptoms like muscle cramps, spasticity, excessive saliva, and pain.
So while there's no cure, there are ways to help manage the symptoms and make life a little easier for people with ALS. What is the role of nurses in caring for these patients?
Nurses are absolutely vital. They provide a wide range of care, from managing medications and monitoring symptoms to providing emotional support
Right.
and connecting patients and families with resources and support groups. As the disease progresses, nurses help with tasks like bathing, dressing, and eating, as well as managing breathing difficulties. They also advocate for their patients' needs and ensure that their wishes are respected, especially as end-of-life decisions become more prominent.
Nurses are truly on the front lines of providing compassionate care for those with ALS.
They are.
Okay, ready to tackle our final condition for today's deep dive.
Bring it on.
All right, let's talk about Huntington's disease, a condition I know has a genetic component.
You're right. Huntington's disease, or HD, is an inherited neurodegenerative disorder.
Yeah.
It's caused by a mutation in a single gene, and if one of your parents has HD, you have a 50-50 chance of inheriting the mutated gene.
Oh, wow.
And if you do inherit it, you will eventually develop the disease.
That's a tough reality to face. What happens in the brain when someone has HD?
Well, HD affects a part of the brain called the striatum, which is involved in coordinating movement, controlling thoughts and emotions, and processing rewards. As the disease progresses, nerve cells in the striatum begin to die off, leading to a range of symptoms that affect movement, thinking, and behavior.
What are the typical symptoms of Huntington's disease?
HD is often characterized by a triad of symptoms:
Okay.
movement disorders, cognitive decline, and psychiatric disturbances. You might see involuntary jerking or writhing movements, known as chorea, problems with balance and coordination, difficulty speaking and swallowing, and changes in personality and mood.
Wow.
Nurses are often the first to notice these subtle shifts and can play a key role in early detection and intervention.
It sounds like an incredibly challenging disease to live with. Are there any treatments available?
Unfortunately, there is no cure for HD, and current treatments focus on managing symptoms and slowing the progression of the disease. Medications can help control chorea and address some of the psychiatric symptoms, and therapy, such as physical, occupational, and speech therapy, can help people maintain function and independence for as long as possible.
So while there may not be a cure, there are ways to support people with HD and help them live as fully as possible. What role do nurses play in caring for people with HD?
Nurses are instrumental in providing comprehensive care for people with HD throughout the course of the disease.
Yeah, okay.
They administer medications, monitor for side effects, and provide education about the disease and its management. They also offer emotional support and counseling to patients and their families who are often profoundly affected by this disease. As HD progresses, nurses help manage increasingly complex symptoms, assisting with tasks such as bathing, dressing, and eating, and providing support for communication and mobility challenges.
It sounds like nurses are truly essential members of the care team, providing compassionate and expert care to those facing the challenges of HD.
Without a doubt. Their role is multifaceted and crucial for ensuring the best possible quality of life for individuals living with HD and their families. It's amazing how much ground we've covered, from the common but often misunderstood tension headaches to the complexities of Parkinson's and HD. We've really gained an appreciation for the challenges faced by those with these conditions.
Absolutely. And we've also highlighted the essential role nurses play in providing care and support. There are a couple more conditions we haven't touched on yet. One that I think deserves attention is epilepsy. I understand it's a condition that causes seizures, but what exactly is a seizure in simple terms?
Imagine a sudden surge of electrical activity in the brain, kind of like a short circuit.
Okay.
That's essentially what a seizure is. It disrupts the normal functioning of the brain, and the effects can vary widely depending on which part of the brain is affected.
So it's not just the dramatic convulsions we sometimes see in movies?
Not at all. Seizures can be incredibly subtle. Some
Yeah.
people might simply stare blankly for a few seconds, while others experience brief episodes of twitching unusual sensations, or a sudden lapse in awareness. These are often referred to as focal seizures, affecting a limited area of the brain. Then there are generalized seizures, where the electrical disturbance spreads throughout the brain, potentially leading to loss of consciousness, and those classic convulsive movements.
It sounds like there's a whole spectrum of seizure presentations. What are some of the things nurses do to help people with epilepsy, both during and after a seizure?
And nurses are absolute rock stars when it comes to epilepsy care. First and foremost, if someone's having a seizure, nurses are trained to ensure their safety. They'll protect the person from injury, clear the surrounding area, and make sure their airway is open. After the seizure subsides, nurses carefully document what happened, how long it lasted, any preceding or following symptoms, and so on. This information is crucial for the doctor to determine the best course of treatment.
It sounds like nurses are essential in those acute situations, but what about the long-term management of epilepsy?
Nurses play a vital role in long-term care as well. They educate patients and their families about epilepsy, explaining the different types of seizures, and teaching them how to manage seizures safely. They also administer medications as prescribed, monitor for side effects, and advocate for adjustments if needed.
So managing medications and responding to seizures are key parts of a nurse's role. What about preventing seizures in the first place? What are some strategies nurses might use?
Nurses are all about empowerment. They'll work with patients to identify potential seizure triggers, such as stress, lack of sleep, or certain medications, and help them develop strategies to avoid those triggers. They might teach relaxation techniques or connect patients with support groups and resources to help them cope with the challenges of living with epilepsy.
That's great. It's important to remember that epilepsy is a manageable condition for many people, and nurses are there every step of the way to provide support and guidance. Okay, ready for our final deep dive of the day?
Absolutely. Bring it on.
All right, let's talk about restless leg syndrome, or RLS. I know it sounds a bit strange, but it can be a real nuisance for people who have it. What exactly is going on in the body when someone experiences RLS?
It's one of those conditions that's hard to explain unless you've experienced it yourself. Imagine this. You're trying to relax, maybe settle in for the night, but you have this overwhelming urge to move your legs. It's not exactly pain, but more like an unpleasant creeping, crawling, or tingling sensation deep inside your legs.
I can see how that would make it tough to relax, especially when you're trying to fall asleep. What causes this strange sensation, and what can be done to help people who are struggling with it?
The exact cause of RLS is still somewhat of a mystery, but it seems to be related to a dysfunction in the way the brain uses dopamine, that neurotransmitter we talked about earlier that's involved in movement. It's like there's a misfire happening in the dopamine pathways, leading to that irresistible urge to move. For some, it's linked to iron deficiency pregnancy or certain medications, but for many, the cause remains unknown.
So it's a bit of a mixed bag in terms of causes. What about treatment? What are some things nurses can do to help people with RLS?
Nurses excel at providing supportive care and guidance. For people with RLS, they can help patients identify potential triggers like caffeine, alcohol, or certain medications, and encourage lifestyle changes like regular exercise and a consistent sleep schedule. They might also recommend strategies like leg massages, warm baths, or applying heat or cold to the legs to provide temporary relief.
It's about empowering patients to take an active role in managing their condition. Are there any medical treatments available for RLS if lifestyle changes aren't enough?
Absolutely. For more severe cases, medications that boost dopamine levels in the brain, like those dopamine agonists we discussed earlier, can be very effective. Nurses play a key role in educating patients about these medications, monitoring for side effects, and ensuring they're taking them correctly.
Well, this has been an incredibly informative deep dive. We've covered a lot of ground today, from headaches and epilepsy to restless leg syndrome. And we've really gained a deeper understanding of these chronic neurological conditions.
We've also highlighted the incredible work nurses do to support patients and their families, helping them navigate these challenges with compassion and expertise. They truly are the unsung heroes of neurology.
Couldn't agree more. So, to wrap things up, if there's one thing we want you to take away from this deep dive, it's this. If you're experiencing any unusual symptoms, don't hesitate to seek medical attention. Early diagnosis and treatment can make a world of difference in managing these conditions. And remember, nurses are there to advocate for you, provide support, and help you live your best life possible. So until next time, keep learning, keep exploring, and keep diving deep into the fascinating world of knowledge.